The best way to stay healthy while traveling abroad is by being proactive before leaving the United States. The following slides will help you prepare to have a healthy time abroad. Traveling always poses risks, but preparing yourself for the challenges that you might face abroad will minimize the risks. It is recommended to have a pre-travel health consultation with your primary care physician, take care of any dental work that might need done, and also to consider your psychological stability before traveling abroad. The Auburn University Medical Clinic as well as student counseling services are available right here on campus to support students before traveling abroad. Auburn Abroad also recommends notifying your faculty directors or study abroad program staff of any necessary accommodations via the Health and Emergency Treatment Questionnaire to mitigate any risk while traveling abroad. If you have a fever or are visibly ill on the day of your travel, it is recommended to not travel and change your ticket. Passengers can be quarantined for an unspecified amount of time in the host country airport if it is discovered that they could pass along an illness. If you take prescription medicine, please ensure that the medicine is legal in your host country. Not all medicine prescribed in the United States is legal in other countries. Talk with your physician before leaving the United States to ensure that you have enough of your prescription medicine to last you during your time abroad. Be sure to transport prescription medications in their original containers that have your name on them, and request letters from your physician detailing your prescription and condition on their office's letterhead. Birth control and over-the-counter medicine is exempt from the previous mentioned instructions, but still transport them in their original containers. Make sure that you are up to date on your immunizations and consult with your physician and the Center for Disease Control, World Health Organization, and or the AU Medical Clinic to learn if there are other immunizations that are recommended for travelers to your host country or region. In general, know that your health affects the rest of the group. Remember to stay hydrated, use sunscreen and bug spray, sleep and eat well, be cognizant of food and water sanitation and preparation, take extra glasses or contacts, practice safe sex, and be open and upfront if you are not feeling well so that your program director can help you find appropriate care. If you have a pre-existing condition, you can continue treatment and support while abroad. Each student has international insurance that covers them during their time abroad, so if you are interested in continued treatment and or support while abroad, you can set up a case with United Healthcare Global before arriving in your host country to ensure services will be available for you. If you are registered with the Office of Accessibility, please provide a letter detailing your accommodations in advance. Depending on your host country, universities may not be required to comply with the same accommodations that apply at Auburn University, but your program staff will attempt to get assistance on your behalf.
Chronic illness.
Many of you suffer from chronic illnesses such as diabetes, asthma, heart disease, seizure disorders, and autoimmune diseases such as rheumatoid arthritis and ulcerative colitis. If properly managed, chronic health conditions should not keep anyone from having a great time overseas, as long as they're prepared. If you are an insulin-dependent diabetic, make sure that you have an adequate supply of insulin, syringes, and glucose monitors. Take written instructions from your physician in the event you're challenged at airport security with your medical supplies. If you're asthmatic or suffer from severe allergies, remember that many cities such as Beijing, China, are heavily polluted and can rapidly cause an otherwise stable condition to decompensate. While those with autoimmune diseases must remember that a change in environment can make things worse. If you are enrolled in a disease management program or have a routine for controlling the symptoms of your illness, be aware that your regular schedule is likely to get pretty disrupted.
Mental illness.
If you have ever sought help for a mental or nervous disorder, which includes anorexia, binge eating, bulimia, anxiety, panic attacks, depression, bipolar illness, schizophrenia, personality disorder, or obsessive compulsive behavior, We highly recommend that this information be disclosed to your study abroad advisor. It's also important to check with your treating psychiatrist or therapist to make sure that your condition is stable enough to withstand the loss of your support system, the lack of resources to help you through a crisis, and the stress of culture shock, the reaction of being immersed in an environment which is new and different. Many study abroad programs have been disrupted by a participant who had a nervous breakdown shortly after arrival overseas. So if you have failed to disclose such a condition, please reconsider and remember that appropriate help for mental illness is difficult to find in many parts of the world.